My name is Professor Stanley Khainga. I'm a consultant, plastic, reconstructive, and aesthetic surgeon. I also teach at University of Nairobi. Liposuction is, in a layman's language, is removal of fat cells or fat tissue under the skin. But there are various techniques that you can use to do that. You can use assisted liposuction, just suction machine. You suck the fat. You can use ultrasound assisted liposuction. You use ultrasound energy to liquefy the fat and you suck it out. Or you can use power assisted liposuction. You can combine liposuction and skin excision so that you get the tone. Age is not an issue unless age is associated with medical problems like lung problems, which are called pulmonary problems. Liposuction is a procedure to enhance the looks of an individual and give you nice curves which are pleasant to look at. It's not a weight losing procedure. You may, an individual may lose some weight, but if you tell the patient or the client that this is a weight losing procedure, then you may find yourself on the wrong side. For one to undergo liposuction, you will tell them you need to exercise a bit, and you need to know exactly what you want to gain from that procedure, because it may just be a localized area, say upper chest or around the breast, or it's the arms that you want, or it's the lower abdomen that you want, and so on. There are those ones that would require a more enhanced procedure, which we call high volume. The high volume is anything beyond 2 liters of fat you are sucking. There's a low volume, moderate, and the high volume. And this high volume, you can even do what nowadays we call a 360 liposuction, whereby you suck the lower part of the body, the abdomen, lower chest, lower back, through 360. This enhances the waistline, you enhance the flanks, you enhance the back, and the so-called the Brazilian butt. They call it Brazilian butt. The patient may bleed, but we give what is called tumescent fluid, whereby we inject into the fat cell line mixed with a painkiller which is called lignocaine, and and another adrenaline which controls or constricts the vessel so that it minimizes the bleeding. The patient may develop maybe blood clots or infection eventually, but that's why we have sterile theaters, and we do these procedures under aseptic technique. Obviously, after liposuction, you will see a change, but to get the permanent change, what you will eventually achieve from the procedure, you will see it from 3 months to from 6 to 8 weeks to 3 months. The post-op care is very important. When we do this liposuction, we have to give them massage. We have to compress the areas that we have liposucked. There are corsets that we give these patients. The healing process is normally continuous, and also it depends on the extent of liposuction. If it's in a localized area, then you can be sure that the patient, in a week's time, the patient will be back on duty. But if it's, say, a 360, maybe they may need a week and a half to rest a bit. We encourage them to start moving immediately because it's better for them. You don't want clot formation. After we've done liposuction, one is supposed to be disciplined in terms of healthy nutrition, because most of liposuction patients, they are overweight, some are obese, and then once you undergo the procedure, unless you really skeletonize the area that you are liposucking, because always fat cells will remain, and when fat cells remain, they can accumulate fat. But the good thing is it cannot really go back to where it was if they are disciplined enough and maintain just the weight that they acquire. Dr. Matwa here is a graduate of our program, and he works in Kemu University, Meru town.
The point at which we remove the fat, we use these instruments. We call them cannulas. These are cannula. This is the tip, and this is the point where we connect to the suction machine, and this is the handle point. Then this tip, as you can see, the point is tapered. It's not pointed, it's round. This is to ensure that when you're going in, you don't injure the underlying tissues. In the chances of piercing the muscles and other tissues getting into the abdomen itself, in case you're liposuctioning the abdomen, it's quite rare. And then you can see these small holes here. So these are the holes through which the fat is suctioned, and then there's as you can see, there's a channel over here where the fat now is suctioned into a reservoir. Yes. As you can see, the holes are different. If you compare these two, okay, the holes are smaller, these ones are bigger, all right. And then as you can see here, this is longer, this is shorter. This one, we call it the injection cannula. Remember, when we are doing the liposuction, we inject the tumescent fluid. So this is the cannula that we use to inject. This one mainly is just to inject. Okay, and then there's another one here. Now this is a tip for the machine that we have. We have the VESA machine. This is the tip that we use to give that energy that we need from the VESA. One, to liquefy the fat so that it can easily be suctioned out, and then two, to tone the skin as you are told. They are metallic, okay, more of stainless steel, okay, in that they are not amenable to rust, and these are reusable. We use them from patient to patient, but after a while they do wear out, and then we replace. Okay, depending on where you are liposuctioning, let's say for instance the abdomen, these cannulas, they can go deep, the whole length. We can go deep. Okay, like for instance, if you're liposuctioning on the right side, okay, you can make a small incision maybe in the midline so that you direct it to the right side, and you can still use that small incision to direct it to the left side. So they are far-reaching. They're even longer ones. Okay.
My parting shot is that this is a very rewarding procedure, and almost everyone requires it at a certain age, and the services are available here in Kenya at a very, very affordable price. You don't need to go out there for this surgical procedure.